Welcome back to the Deep Dive, the place where we turn massive stacks of research into clear, actionable knowledge. Today, we are exploring a health strategy that has been around for, well, thousands of years, but is only now getting the serious scientific respect it deserves. We're talking about passive heat therapy, with a really sharp focus on sauna exposure.
It's such a classic case of tradition meeting modern validation. I
Mhm.
mean, the practice of using heat for healing and purification is so deeply rooted in many cultures.
Especially in Finnish tradition, right?
Exactly. But our sources today show that the mechanisms behind all the benefits people report are uh, profoundly physiological. They're driven by something called an adaptive stress response.
Or mild hyperthermia.
Precisely.
Okay, let's unpack this. We've got this tremendous stack of sources in front of us. It covers everything from the cellular repair mechanisms all the way up to these incredible longevity studies tracking people for over 2 decades.
It's a huge body of evidence.
So our mission today is to review the most compelling findings and really understand how targeted heat exposure impacts your muscle performance, aids in heat acclimation, and improves your cardiorespiratory health.
And of course, how it contributes to cellular repair and systemic longevity.
To start, let's define the environment, because
Well,
the research uses two very different modalities.
that's a great place to start. The one that's most extensively studied is traditional Finnish sauna bathing, or FSB.
So what does that actually look and feel like compared to, say, an infrared sauna?
FSB is the classic dry air, high temperature environment. We're talking 80 to 100 degrees Celsius.
Wow, so it's intense.
It's intense, but with very low humidity, maybe 10 to 20%. You're hitting the air around you. Then you have the infrared sauna, or IRS.
Okay.
This uses infrared emitters to heat your body directly. This means the air temperature can stay much lower, maybe 45 to 60 degrees Celsius, with no added humidity. But both are ultimately aiming to induce that core temperature elevation.
Let's start at the absolute foundation then, the molecular level. When we expose our body to this thermal stressor, what is happening inside our cells? Why does getting hot trigger all these adaptive gains?
The foundational mechanism is the upregulation of heat shock proteins, or HSPs.
Heat shock proteins.
Yep. And you can think of HSPs as your body's specialized molecular chaperones. They're like a cellular maintenance crew.
A maintenance crew that gets hired specifically when things get hot.
Precisely. They are triggered by heat stress, and their main job is to maintain something called proteostasis.
Proteostasis.
It's just a scientific term for protein homeostasis. These proteins are constantly working to keep the structural integrity of your cells intact.
So they're literally keeping the building blocks of life functioning correctly.
Exactly. They prevent misfolding, they aid in repairing proteins that are slightly damaged, and crucially, they facilitate the breakdown of components that are just beyond repair.
And that's vital, I imagine.
It's absolutely vital. Disruptions in that process contribute heavily to aging and various chronic diseases. We see specific proteins like HSP70 and HSP27 linked directly to improved cellular protection and reduced oxidative damage.
And the sources connect this mechanism to growth pathways as well, right?
Oh,
I saw mention of the ACTMTR pathway being activated. For listeners who aren't molecular biologists, what does that mean in simple terms?
right. That pathway is often called the master switch for growth and survival in the cell. So when HSPs kick into high gear, they signal to pathways like ACTMTR, which regulate cell growth, division, and protein synthesis.
The things you'd really care about if you're trying to build muscle or enhance recovery.
You've got it. That's intense cellular management.
It is. But what's the first observable benefit we see systemically from all this protection? Is it, say, reduced stress, or is the anti-inflammatory effect more immediate?
They're both tightly linked, but the anti-inflammatory effects are highly visible in the long-term data. Frequent sauna use demonstrates a pretty significant reduction in inflammatory markers. The ongoing Finnish cohort studies, the KIHD, study tracked users over 11 years and consistently observed lower baseline levels of C-reactive protein,
And that's a key marker for inflammation.
a very key marker. And they also saw a reduced leukocyte count in frequent users.
It's so rare to see a lifestyle intervention show that kind of consistency over a decade. What does that suggest about the mechanism?
It suggests the health benefits aren't just acute, a one-off thing. They may be mediated by this chronic reduction in systemic inflammation. The sauna seems to promote anti-inflammatory mediators while modulating the pro-inflammatory ones.
Okay, and what about on the hormonal front? I saw some pretty interesting numbers there, especially for men focused on performance.
Yeah, there's a fascinating effect there. Acute or repeated sessions modulate cortisol, your primary stress hormone, which is often reduced post-sauna.
So it promotes relaxation.
It does. But the most dramatic finding relates to growth hormone, or GH. One study showed that GH levels in males could see a significant, and I mean significant, 16-fold increase over 7 days of consistent use.
A 16-fold increase.
16. Now, that particular protocol was quite intense. 80 degrees Celsius for 1 hour, twice a day, but still.
That is a remarkable jump on a molecular level. But let's bring that down to Earth.
Yeah.
How do these deep cellular optimizations translate into something tangible, like faster race times or better performance in the gym?
They absolutely translate into real-world performance gains, primarily through adaptations that enhance cardiovascular efficiency and muscle recovery. For endurance athletes, the first thing is plasma volume expansion.
Okay, why does expanding your plasma volume matter if you're a runner or a cyclist?
Plasma volume is just key for cooling, for heat dissipation, and for circulating oxygen. A 2007 study on competitive male runners found that after just 3 weeks of consistent post-exercise sauna use, they saw a striking 32% increase in plasma volume.
32% in 3 weeks.
And crucially, this translated into measurable performance. A 1.9% improvement in their 5-kilometer time trial.
That's a significant improvement for just a 3-week commitment. That's very encouraging data.
And it goes beyond endurance. It impacts strength and power. Rapidly increasing your muscle temperature improves muscle contractility, overall strength, and something called the rate of force development, or RFD.
RFD, which is how quickly your muscles can generate that power when you really need it.
Exactly. And what's particularly fascinating is the systemic nature of this benefit. A 2021 study on hand grip strengthening showed the sauna group saw improvements in maximal strength for both the trained hand and the untrained hand.
The non-exercised hand got stronger too.
It did, which strongly suggests the benefits are mediated systemically, through hormonal and molecular signaling, like the HSPs we talked about, not just localized heat.
That explains why the benefits seem to be so broad. And what about acclimation for people who have to operate in hot environments? Military, firefighters, athletes.
Sauna use is a really viable, cost-effective method for achieving heat acclimation because it successfully mimics that heat stress. You're effectively training your body's internal cooling systems.
Which leads to adaptations like
What?
a higher sweat rate?
An increased sweat rate,
Yeah.
a reduced resting core temperature, and enhanced cardiovascular stability. All things that make it easier to perform when the mercury rises.
And we can't forget recovery. What about gains in flexibility and reducing that awful muscle soreness after a heavy session?
Flexibility gains are linked to increased tissue temperature and muscle relaxation. It just reduces muscle tension. We even have data showing that sauna yoga can improve posterior chain and shoulder flexibility in older adults.
Interesting.
And for active recovery, the sources noted that infrared sauna is particularly good for improving neuromuscular performance and reducing muscle soreness after resistance training. It seems that slightly lower temperature and direct heat might be ideal for that kind of muscle repair.
That brings us to the biggest picture. Let's talk longevity and chronic disease prevention. This is where the long-term data, particularly from Finland, really forces you to pay attention.
It absolutely does. The ongoing Finnish cohort research, which has been tracking these users for decades, it provides just incredibly robust dose-dependent evidence.
The more you do it, the better the outcome.
That's what it shows. When you compare individuals using the sauna 4 to 7 times per week versus those using it just once a week, the frequent users had about a 40% lower risk of all-cause mortality over 2 decades.
40% lower risk of dying from any cause. That's just an astonishing figure for a passive, accessible activity.
It's a truly powerful finding, and the cardioprotective effects are equally profound. Frequent Finnish sauna bathing is associated with a substantially decreased incidence of CVD events, sudden cardiac death, and stroke.
How substantial are we talking for stroke risk?
We've seen reports of up to a 62% reduced risk of stroke with frequent use.
Wow. And it also seems to act like a natural blood pressure regulator.
That's right. Regular use is strongly associated with reduced blood pressure. The long-term data showed men who used the sauna 4 to 7 times weekly had a 47% relative decrease in the likelihood of developing hypertension.
Over a 24-year follow-up, that's an effective non-drug approach.
It really is.
And beyond the heart, are there protective effects for, say, our respiratory and nervous systems?
Yes, absolutely. The immune and nervous systems show strong protective effects. Sauna use is linked to a reduced incidence of respiratory conditions like pneumonia, with risks cut by 33 to 53% in frequent users.
So you're less likely to get sick.
And you see a significantly reduced incidence of common colds. This is likely tied back to those anti-inflammatory effects we mentioned earlier.
And what about the brain? That's where those HSPs are working overtime to maintain that protein balance, that proteostasis.
This is perhaps the most exciting area of research right now: frequent sauna bathing.
Let me guess, 4 to 7 times a week.
You guessed it. It was associated with a 65% reduced risk of Alzheimer's disease and a 66% reduced risk of dementia. 65%. That's incredible neurocognitive protection.
It's thought to work by reducing inflammation in the brain and improving cerebral vascularization. Even more strikingly, a separate study noted a 77% reduced risk of developing psychotic disorders in men with that same frequency.
That's a powerful argument for making this a consistent routine, particularly as we look at aging. And before we move to practical steps, what about metabolic regulation?
Excellent point. FSB improves lipid profiles, specifically decreasing total cholesterol and increasing HDL, especially when you combine it with exercise. And other passive heat therapies, like hot tubs, have shown promise in improving blood glucose and HbA1c levels in patients with type 2 diabetes.
So it's beneficial across the board metabolically.
It seems to be. And a critical safety finding. Despite all the intensive sweating, frequent sauna use was not associated with impaired kidney function.
That's a comprehensive list of benefits.
Yeah.
Okay, now for the practical application. The sources mention dosing heterogeneity. What does that mean, and how does it complicate setting an exact schedule for someone listening? Dosing heterogeneity simply means the research studies use wildly different temperatures, times, and frequencies. One study might use 80 degrees Celsius for 30 minutes. The next might use 90 for 15. So it makes setting one single perfect standard a bit difficult.
Understood. But based on the longevity and cardiovascular findings, what is the best evidence-based range for frequency and duration?
Well, the optimal benefits are clearly seen at 3 to 7 sessions per week. But even 1 to 2 times a week yields measurable cardiovascular benefits, so consistency is really key.
And duration.
Generally, 10 to 20 minutes is adequate to induce the thermoregulatory changes you need for that adaptive stress response. Experienced users might go up to 30 minutes.
Should we be thinking about one long session, or is it better to take breaks?
The Finnish tradition often incorporates multiple rounds with a cooling break in between, and that approach is validated in the research. Those cooling periods are essential for maintaining comfort and enabling a second or third exposure safely.
Right, and for temperature, just to remind everyone.
Traditional FSB is 60 to 100 Celsius, and infrared is 40 to 60 Celsius. The key is to start low and acclimatize gradually.
Finally, before we wrap up, we absolutely must cover the critical safety protocols. What are the major risks and contraindications here?
The most common adverse events reported are, believe it or not, mechanical. Slip and falls account for over half of all injuries. After that, it's syncope or dizziness from overheating. But we need to be absolutely clear. The most severe adverse outcomes are overwhelmingly linked to one thing.
What is the single non-negotiable safety warning here? Because the data I saw on alcohol was staggering.
It is the complete avoidance of alcohol consumption. Alcohol intoxication was present in over half of all sauna-related deaths.
Over half.
Because it significantly impairs your judgment, it increases your risk of losing consciousness, and it exacerbates severe hypotension, low blood pressure. You must never, ever combine sauna use with alcohol.
That is a powerful warning that cannot be overstated. And what about hydration?
Hydration is critical. You're going to lose between half a liter and a full liter of fluid per session. It must be replaced immediately. And finally, anyone with high-risk pregnancy, unstable angina, a recent heart attack, or severe heart failure should avoid sauna bathing entirely. Always check with your doctor.
That brings us to the end of this deep dive. We've journeyed from the molecular guardians, the heat shock proteins protecting your cells, all the way through to enhanced athletic performance and recovery. And then to the really compelling evidence suggesting greater longevity and profound neurocognitive protection. It's clear that incorporating regular sauna use, done safely, is an evidence-based method for promoting overall resilience and health.
Indeed. The physiological responses to sauna bathing effectively mimic those produced by moderate exercise. This means you are reaping cardiovascular and systemic benefits, often independent of your physical fitness level.
So, what does this all mean for you? The sources noted that combining regular sauna use with physical activity enhances the benefits for cardiovascular health and mortality, suggesting a synergistic effect. So consider this. If passive heat stress mimics moderate exercise, how might you leverage the sauna to maintain your fitness adaptations during periods of forced lower activity, like when you are recovering from an injury or during an off-season? That's a thought to mull over until our next deep dive.